Assalamualaikum. My name is Nur Izzah binti Rosli and my matric number is PC09200064. So for this Pharmacology 1 group assignment, my task is to identify the names and indication of each drugs in my groups, that is guargam, glibenclamide, sitagliptin, rosiglitazone, acarbose, metformin, gliclazide, and buformin. Fun facts: these drugs has the similarities of the indication, that is, it is an anti-diabetic drug. So let's move to the first drugs, that is guargam. Guargam is an anti-diabetic drug. It is used to treat diabetes and it will lowering the blood sugar. Guargam also used for a diet supplement. Second drug is glibenclamide. Glibenclamide is an oral anti-diabetic drug. This drug is the treatment of type 2 diabetes to control blood sugar level. It is also used for diet and exercise. So the third drug is sitagliptin. Sitagliptin used in a proper diet and exercise, same goes with glibenclamide. This drug also used in people with type 2 diabetes to control high blood sugar. So the next drug is rosiglitazone. Rosiglitazone is an anti-diabetic drug. Is used to treat the symptom of type 2 diabetes mellitus to lower the glucose level. Other than that, acarbose is the treatment for adults with type 2 diabetes mellitus. Acarbose also to adjunct to diet only. Next is metformin. Metformin treat type 2 diabetes. It will lower your blood sugar level by improving insulin with injection. So the next drug is gliclazide. Gliclazide is the medicine used to treat type 2 diabetes. It will lower the glucose level by increasing the insulin in the body. Gliclazide is also an anti-diabetic drug. So the last one is buformin. Buformin is an anti-diabetic drug. This drug is the treatment for type 2 diabetes mellitus to decrease the blood glucose. The next task for my friends in the next video. Bye.
Hi, Assalamualaikum. My name is Nur Aklimah binti Hasbullah. My matrix number is PC092053. This is the comparison of this drug. First drug is guargam. For adult is 5 gram tate. Dose to be taken with at least 200 ml of fluid. For geriatric, no dose investigated found. For pediatric, not recommended. Second drug is glibenclamide. For adult is as conventional type. Initially 2.5 to 5 mg daily. For geriatric, 70 years, contraindicated special patient group. For pediatric, usually pediatric does not effective in insulin-dependent diabetes. Third drug is sitagliptin. For adult is 100 mg once daily. For geriatric is 50 mg once daily. For pediatric is not recommended. Fourth drug is rosiglitazone. For adult is 2 mg or 4 mg per day. For geriatric is no dosage adjustment needed. For pediatric, safety and efficacy not established. Fifth drug is acarbose. For adult is 50 mg or 100 mg and 25 mg. For geriatric is no dose reference for the elderly. For pediatric is the efficacy and safety of acarbose have not been investigated in patients aged below 18. Sixth drug is metformin. For adult is to the following strength: 500 mg to 750 mg to 850 mg to 1000 mg or 500 mg or 5 ml. For geriatric is adjust dose based on renal function. For pediatric is 10 years, initially 500 or 850 mg once daily. Seventh drug is gliclazide. For adult is dose initially 40 to 80 mg daily, gradually increased to 320 mg daily if necessary. For geriatric is no dose reference for the elderly. For pediatric is no dose investigated patient below 18. Eighth drug is buformin. For adult is up to 300 mg daily. Normally adult and elderly are same. The dose of buformin is up to 300 mg daily. However, everyone can be different. For pediatric there is no stipulation for the dose of this drug for children because this drug can be dangerous for children. Before use, consult your doctor or pharmacy for more information. Thank you.
Hi, Assalamualaikum. My name is Amira Izzati Beti Amri. My nomenclature is PC1220001. My part is doses, renal failure and renal impairment. First drug is guar-gum. The dose that has to be taken at least 200 ml of fluid. Second is clobazamide. The dose for renal failure is contraindicated. Third is sitagliptin. The dose for renal failure and renal impairment is 25 mg orally once a day. And fourth is rosiglitazone. The data is not available. That is because the doctor or the expert did not find the correct dose for renal failure and renal impairment for that drug. Next is acarbose. Based on creatinine chloride (CrCl) less than 25 is contraindicated. For drug metformin, if EGFR greater than 45 ml, no dose adjustment. But if EGFR 30 to 40, therapy is not recommended. But if EGFR 13, use is contraindicated. Next is buformin, that is up to 300 mg daily. And for gliclazide is for several renal is contraindicated. Okay, that's all for me. Thank you.
Patient with liver impairment and liver failure cannot take guar-gum because it will reduce blood flow of bile from the liver. This patient also cannot take gliclazide because it will be twice as strong. For buformin drug, patient with liver impairment and liver failure can take this drug. For glibenclamide, sitagliptin, acarbose, metformin, this patient also can take this drug, but only with the doctor knowledge instruction because it may have side effect. For enciclitazone, it helps to burn Avandaril, Avendamin, and Avandia. For Avandaril, this patient can take but with minimum dose is 4 mg per glimepiride. For Avendamins, this patient cannot take, and Avandia, this patient can take this drug only once a day.
Good morning, I am Vinodini Sami. My matrix number is PC092001 and 08. Today I want to talk about the contraindication between the different types of drugs. But before that, let me define the meaning of contraindication. It is a condition that serves a reason not to take several medical treatment due to the harm that it will cause to the patient. Contraindication is also known as an opposite meaning to indication. First, guar-gum. Guar-gum should be avoided during some following conditions such as during breastfeeding or pregnancy or gastrointestinal obstruction. Second is glibenclamide should be avoided during pregnancy and breastfeeding too. Then sitagliptin is contraindicated in ketoacidosis. Not only that, rosiglitazone is contraindicated with the patient who is having active liver disease or hypersensitivity. Fifth one is acarbose. Acarbose is contraindicated with the patient who is having inflammatory bowel disease, colonic ulceration, and partial intestinal obstruction. Then metformin is contraindicated in chronic kidney disease. Not only that, glycoside is contraindicated with several renal or hepatic insufficiency. Last but not least is buformin. It is contraindicated with several infection or trauma.
Assalamualaikum media. My name is Nur Nasratul Wahisa binti Anwar Muhammad. My matrix number is PC092046. The risk or severity of hypoglycemia can be increased when a gluten is combined with guar-gum. The metabolism of glibenclamide can be increased when combined with abatacept. The therapeutic efficacy of sitagliptin can be increased when used in combination with acebutolol. The metabolism of acinomorol can be decreased when combined with rosiglitazone. The risk or severity of hypoglycemia can be increased when acarbose is combined with guar-gum. The risk or severity of lactic acidosis can be increased when acetazolamide is combined with metformin. The risk or severity of hypoglycemia can be increased when acetazolamide is combined with gliclazide. The risk or severity of hypoglycemia can be increased when buformin is combined with agloblitine.
Drug, food or herbal interactions. Hello, Assalamualaikum. My name is Nukairunisa Najri binti Suhaimi. My matrix number is PC09200104. Guar-Gum. Food interaction guar-gum may interact with other medication if given at the same time. This can cause your other medication to become less effective. Herbal interaction, anthranoid-containing plant-soluble fibrous guar-gum can decrease the absorption of drugs. Glibenclamide. The food interaction is do not drink alcohol as it can affect the control of your blood sugar. The herbal interaction between sesame oil and glibenclamide combination will decreasing blood sugar level and provided a safe and effective option for the drug combination that may be very useful in clinical practice for the effective improvement of hyperglycemia. Sitagliptin. The food interaction between sitagliptin and grapefruit juice can significantly increase the blood level of simvastatin. The herbal interaction Eugenia jambolana extract reduce the systemic exposure of sitagliptin and improve conditions associated with diabetes. Rosiglitazone. There are no specific food interaction to avoid while using rosiglitazone. The herbal interaction between rosiglitazone and carbapenemer resulting may cause excessive drowsiness. Acarbose. The food interaction of acarbose is alcohol that can affect your blood sugar level. It can both increase the risk of low blood sugar, hypoglycemia, as well as increase your blood sugar levels by serving as an additional source of carbohydrates. The herbal interaction may prevent the fast-pounding heartbeat you will usually feel when your blood sugar level falls too low. Other symptoms of low blood sugar, such as dizziness, hunger, and sweating, are unaffected by these drugs. Metformin. The food interaction is you must avoid consuming large amounts of alcohol because drinking alcohol while taking metformin will increase your risk of developing low blood sugar or even lactic acidosis. The herbal interaction between Karela fruit juice or extract and metformin have been shown to produce greater hypoglycemic effects. Gliclazide. The food interaction is avoid ingestion of alcohol while taking this drug because an intolerance may occur resulting in flushing, giddiness, nausea, and rapid heart rate. The herbal interaction of gliclazide is jamun seeds contain alkaloid, which converts starch into energy and help in reducing diabetes symptoms like constantly feeling thirsty and frequent urination. Jamun seeds in powder form can help in reducing blood sugar levels. Buformin. The food interactions between buformin and alcohol will impair renal function. That will increase risk of lactic acidosis and hypoglycemia. Herbal interaction of buformin is American ginseng that will reduce blood glucose level. That's all from me. Thank you.
I will be presenting and explaining about side effect of drug in my group. First is glibenclamide. Side effects is stomach upset, feeling shaky, anxious, sweating, looking pale, feeling hungry, palpitation, and feeling dizzy. Second is sitagliptin. Side effect is stomach upset, diarrhea, upper respiratory infections, stuffy or runny nose, sore throat, and headache. Third, rosiglitazone side effect is headache, gout, stomach upset, blur versions, chest pain or discomfort, dry mouth, flush, feeling hungry, feeling thirsty, increased urinations, irregular heartbeat, nausea, pale skin, rapid weight gain, sweating, trouble breathing, feeling tired, vomiting, and diarrhea. Fourth, Acarbose side effect is stomach discomfort, gas bloating, skin rash, diarrhea, and itching. Fifth, metformin side effect is heartburn, stomach upset, nausea or vomiting, bloating, diarrhea, constipation, weight loss, and headache. Sixth, gliclazide side effect is stomach upsets or indications, nausea, vomiting, diarrhea, and constipation. 7. Metformin side effect is anorexia, nausea, and diarrhea. Lastly is Coargum. Side effect is increased gas productions, diarrhea, and loose stool.